It's estimated that 8 out of 10 patients use their inhalers incorrectly. In this video, I'll show you how I want my patients to use their metered dose inhalers. Why is it essential to get your inhaler technique good? Mastering your inhaler technique is crucial. Doing so ensures the medications you're taking get to the areas of the lungs where they're needed. With proper technique, you can spend less time feeling wheezy, experience fewer side effects, and reduce your chance of admission to hospital. These are metered dose inhalers. They come in different colours, but they all contain a pressurised canister, which contains the medication, an actuator, and a dust cap. Personally, I suffer from asthma and use an inhaler as part of my treatment. I want to clarify that I'm not here to promote any specific brands or medications, but the inhalers I'll be using are obviously going to be the ones that are prescribed for me. I use my Preventer inhaler twice a day and wanted to share my routine for using this corticosteroid inhaler with you. Preparation. When you first receive your inhaler, or if you haven't used it for a few days, you must prime it. To prepare your inhaler, remove the cap and shake it well. Make sure the mouthpiece is pointed away from you and press the canister to release a test spray into the air. The number of test sprays you will need will vary depending on your inhaler, so be sure to refer to the instructions. Once the test sprays are completed, your inhaler is ready to use. Be aware that some inhalers have a dose counter, so verify it's not empty before using it. Now you're ready to start. Hold your inhaler upright and remove the dust cap. Check that there's nothing inside the inhaler, especially if they've been hanging around in pockets or drawers. Give your inhaler a good shake. This mixes the medication and the propellant within the canister. Sit up or stand tall. Breathe out until you feel like your lungs are empty. Next, place your lips around the inhaler's mouthpiece and simultaneously press down on the canister whilst breathing in. Try to breathe in slowly and steadily until your lungs feel full. Now you can take the inhaler out of your mouth and close your lips. Hold your breath for up to 10 seconds or as long as you can. You can now breathe out gently. If you've been prescribed 2 puffs, wait around a minute before repeating the process. When you're done, just make sure you put your dust cap back on your inhaler, like that. Because my inhaler contains a corticosteroid, there's one additional step. Rinse your mouth out with water or brush your teeth. Doing this will reduce the risk of side effects such as oral thrush. Great, you've got it. If you need a refresher, you can run back the steps in the video and do it with me when you're taking your inhaler. I hope you found this video useful. Good luck in mastering your inhaler technique.